Hi and welcome to the channel Love Obstetrics and Gynecology. In this video, I'll talk about the COPD, its indications, contraindications, the MEC criteria, and finally the insertion steps. We have two types of COPD, the COPD 380A and 375 multiload. These are the two most commonly used COPDs. The insertion timing of these COPDs is in the following manner. If we talk about interval, it is after 6 weeks delivery or postpartum and post-abortal, or you can have immediate post-abortal, postpartum, post-coital. The MEC criteria or the medical eligibility criteria are usually considered under 4. Like the MEC criteria 1 means that there is no restriction on the use of the method, or these are the indications for the method's use. In case of a COPD, we can freely use COPD in case of a multiparous woman. If she is obese or a smoker, she has any CVS or neurological condition, she has any metabolic disturbance such as diabetes or a thyroid disorder, liver gallbladder disease, or she is on any anti-epileptics, anti-tuberculosis drugs. And you can see these are actually the contraindications for OCPs. So we can use the COPD in case the patient is having these complications. The next we have is the MEC criteria 2, where the benefit outweighs the risk, and MEC criteria 3, where the risk benefit outweighs the benefit. So MEC 2 is the relative indications and MEC 3 is relative contraindication. But let's now remember what are the absolute contraindications. The absolute contraindication, that is MEC 4, where we do not use the method, is in cases of an active infection, PID, STDs, or just a 3-month history of these. Also, the contraindication includes unexplained vaginal bleeding, malignant gestational trophoblastic neoplasia, any cervical or endometrial cancer, the uterine malformation, either congenital or by a fibroid that distorts the endometrial cavity, or in cases of a post-abortal sepsis or puerperal sepsis. These are the absolute contraindications. Now let's start with the procedure of COPD insertion. So what do we require for this COPD insertion? First we require is a SIMS, posterior vaginal wall retractor. This is bi-bladed one. This is used for retracting the posterior vaginal wall. The next up is valcellum. The valcellum here you can see is curved in its forepart, right? Curved in its forepart and has multiple serrations or multiple tooth so as to grasp the anterior lip of the cervix. Next we require is a sponge holder or ring forceps so as to clean the cervix before the insertion. The next up is the uterine sound. The uterine sound is required to measure the uterocervical length so that we can appropriately measure the uterocervical length for the insertion of COPD, and also a pair of scissors. Then we also require some sterile swabs to clean the cervix, and finally a COPD. So this makes my tray. Now let's moving on to the insertion procedure. Firstly, you will retract the posterior vaginal wall of the SIMS speculum and held the anterior lip of cervix with the valcellum. Next is clean the cervix with the sponge holder, and then finally take a uterine sound and introduce it into the uterocervical area so that we can measure the UCL. So in this model uterus, I am going to insert my uterine sound and through the external os, internal os, and then finally reaching up till the fundus. And when it reaches the fundus, I'll mark with my index finger of the internal examining finger at the level of external os and take it out. This gives me my uterocervical length. Now this is very much important so that we can adjust my mark on the COPD as per this this uterocervical length. Now this is my COPD, and let's talk about its various parts first. So this is a COPD that is inside an outer tube, and that outer tube contains a flange this blue one is the flange, and it also contains a plunger that has to be put inside this outer tube, and this is my copper T 380A that has two arms, horizontal limbs and a vertical limb, and this one is a flange, the blue one, right? This is my copper T. Now there are two methods for actually bending the copper T inside the tube, because we need to bend the horizontal limbs before the insertion into the outer tube or the inserter plastic, right? So here the first method is that you open the packet just halfway. Now here you completely do is a method that is known as no touch technique. So the packet gets opened only till halfway, and that from the opposite side where the copper T is not there. Now just slightly slide down the outer tube or the inserter, just slightly down. Now I'm going to bend the horizontal limbs, right? The horizontal limbs inside this plastic inserter. Just moving down the inserter just slightly below. We have halfway opened the packet already, and the copper T is still inside the packet, and I am going to bend the horizontal limbs right into this inserter tube. Now this requires actually expertise, because it is difficult to put it inside this while the copper T is still in the packet. It is very difficult to do this process. Now my horizontal limbs are inside the plastic inserter. The second method that we are going to do is, we are going to completely open the packet, completely open this packet, and now we are going to first wash our hands and then don a sterile pair of gloves, and with those sterile pair of gloves I can now touch this copper T, right? Now I'll touch this copper T and place the horizontal limbs inside the inserter. Now these horizontal limbs are kept parallel to the horizon as per the horizontal orientation of the flange. Then finally, after placing or bending those horizontal limbs, the measured UCL is taken, and with the measured UCL you adjust the flange to that mark as per the UCL. After bending those limbs, it is very important that within 5 minutes we do the insertion. So I have already this is my plunger that I am going to put inside after the limbs have been placed inside the tube. So my copper T is ready for insertion. I have already held the posterior vaginal wall and the anterior lip of the cervix, already done that, cleaning done, and now insertion is going to proceed. So for the insertion, you go through the external os, then further through the internal os and reach it till the fundus. When you reach the fundus, there will be a resistance. So now just come slightly downwards and just move back your copper T. Now stabilizing the outer tube and holding the plunger, just slide the outer tube over the plunger towards yourself, right? This will release your limbs of the copper T. The next is, you are going to you just wait for 30 seconds and then further push just the outer tube, right? Just the outer tube towards the fundus of the uterus, and then finally remove both the inner and the outer tube together, and now you are left with the thread. You have to cut it 2 to 3 cm from the external os with a pair of scissors. Just cut it through, and this is how you do the copper T insertion procedure. Then further is our follow-up. For the follow-up, you ask the patient to come in the next menstrual flow. Now in the next menstrual flow, the patient could be totally asymptomatic and happy with her copper T, but the patient may have following complaints, like she could have complaint of abnormal uterine bleeding, For that, you like to give her tranexamic acid so as to control her bleeding. But despite if the factors that her bleeding does not get controlled, then she would require a removal. Or if she gets a pelvic inflammatory disease or infection, then also it would warrant a copper T removal. And further, if the 2 or 3 years have passed, then she wants to have another child, again you can remove the copper T as she wants a conception. And in cases of a uterine perforation, as it is a foreign body, it will cause an intense inflammatory reaction and it would require the removal. And if in case it has been partially expelled, it also requires a complete removal as it is not a fundally placed copper T. Then after the completion of its lifespan, like for copper T 380A it is 10 years and copper T 375 multi-load it is 5 years, it would require a removal. So if you liked our video, do subscribe and share. Love Obstetrics and Gynecology. Thank you.